everyone, welcome to Ananda. Today we are in conversation with one of our experts, Shweta. She's a school counselor, but she has a tremendous rich experience in the addiction, anger management, and various mental health related issues which are a part of any addiction. So, without wasting any time, let's talk to her about few things and let's get some answers from her. Hello, Shweta. Welcome to Ananda.
Thank you so
First
much.
of all, since you are working in school, you are very familiar with the adolescent phase. Tell us more about the adolescent phase and how a parent-child relationship is during this phase.
Okay, so in various workshops that I take about this particular topic, I always tell the parents that it is the rebirth of their parenting style, because a lot of strategies that they have been using so far with the children completely have to undergo a change from the parents' side as well. So the parents who are more controlling have to be more democratic with their children. At the same time, they have to constantly monitor, what their children are up to, because children at the age of 13 start developing these interests and curiosities about the world around them. They start exploring different avenues, and they might also come in contact with other adults which may be having interests which are not very healthy per se. So parents have to play a very friendly role with their children, especially of the age of 13 to say 21. At the same time, children are very much confused also about their identity, right? They have this identity crisis that, who am I and what am I here for and what is the purpose of life. So I guess parents
puberty also.
Yeah, and their hormones are changing. Everything is changing, like psychologically, physiologically, right? Their social world and emotional world is changing. So parents have a very, very important part to play, a role to play in their children's life by being a very mature guide is what we tell the parents.
Okay, since we are talking about the adolescent phase, the angry reactions is something every parent complains about their adolescent child. So, can you guide us through how to avoid angry reaction, how to react properly? How you train an adolescent to avoid angry reactions?
Okay, so a lot of that has to kind of go into understanding the theory of anger. Okay, so speaking from an evolutionary perspective, I would say anger is important. Yes, anger is very, very important. It's just how you kind of use it. If you use it in best of your interest by kind of being competitive with other children, in the sense healthy competition. If you direct it in sports, I would say that channelizing the anger that children have, the kind of rage that children have during this phase of adolescence, like 13, 15, 16, they can direct it in a very positive manner. So maybe on the ground, or while having debate competition, being more participative, having ambitious goals about their careers. So maybe they can put in their anger and they can generate it and they can use it in a very positive way. Now, when it comes to home environment, home setup, how do we deal with anger? Okay, so I would say that parents have to firstly understand that our children are going through a lot. Okay, and there could be numerous things that the children are not really venting out with their parents, because now they have started seeing that the parents are a little different and they also have their flaws, right? So children kind of see through those things, so they might not really take your word for what it is, right? You can't just tell them something like get this done and instruct them, and you cannot expect that they follow it immediately. So you have to be more logical with them, number one. Number two, I would suggest children do practice a lot of meditation. If meditation kind of bores them out, then they can also try deep breathing, okay, being more mindful. And parents have to also do it along with them. It's not just the responsibility of the children, you just don't instruct them and go away from there.
So this is something very similar to the toddler or the mid phase of childhood where parents have to do it, then only your children will follow it.
Yes.
So this rule never changes.
This rule never changes.
Adolescent also, they have to follow their parents.
Correct.
So learn from them.
Right. So the parents have to model the behavior that they are expecting from their children. It's not that you can have that gap, where the parents are doing something which is completely opposite to what they expect from their children. Otherwise, you will see these angry reactions where the children are going to be very rebellious. And I also say there's a lot of times that children have to experience. Okay, so let them go through those experiences. For example, I would give a very small example. Children might want to go for trekking that age, especially 13, and the parents might say that no, it is very dangerous for you. So you make sure that all the requirements and all the precautions are taken. Let them experience it. Parents have to really remove the barriers of stopping their children from doing things that is going to make them rebellious. So you do not become trigger for your child is what you have to consciously remember as a parent. And children have to remember, let's respond versus react. Okay, you can just take time, process things, and then you can react to situation instead of being like, okay, I want to do this immediately. Okay, so let's cut out on those impulsive moments and instead take time to process what is the situation. If your friend is not behaving nicely with you, or adolescents may have relationship issues also, so take time to analyze. Talk to an expert. I would suggest talk to a counselor. Take your parents on your team, build a nice family team and then resolve your problems. So instead of reacting and lashing out at the people who care for you, I think you should really become a little calm and think about the things in a very slow and steady manner.
So should focus more on responding instead of reacting, and parents should actually control their parental anxiety to provide the necessary secure environment and let your child explore a few things on their own.
Yes.
Right. Thank you so much, Shweta. So again, teenage and anger and addiction are things which go hand in hand in many cases. So what is exactly addiction?
Addiction is, I would break it down to a kind of behavior that is consistently done towards stimuli in the environment. It could be either substance abuse or probably gambling or gaming or watching a lot of television, and it is out of control. So probably the person who is addicted might also feel like, controlling it and stopping it, but that is just out of their hands. So I would say that repetitive, compulsive and that kind of behavior which cannot be stopped even when you know that it is extremely unhealthy is what is addiction about.
And how to control addiction? This is the most common questions asked by many people.
Right.
How to control it?
Yes. So there are various types of addictions. One could be substance addiction, where you really want to get your hands on various drugs or alcohol, which you want to consume and make yourself feel better. Okay, it could also include smoking or nicotine related addiction. That is one. And the other is experiencing things, like for example gaming. So gaming really makes you feel like you're winning the situations in your life and it gets you a little high. It brings in a lot of feel-good feeling, right? Right. So you feel really nice about that whole experience. But the end result is always negative. So I would suggest that the parents, the team, I would always call it a team, the team of parents and children, they get together and they go to a therapist which is knowledgeable about therapies like CBT, DBT. Also, they motivate their children to kind of not do these things and look at the other healthy areas of their life or healthy coping mechanisms. Also, you could get in touch with a therapist who is good at contingency management. So kind of rewards are given to children to get off that addiction. That kind of helps. Also 12-step program. Okay, something like Alcoholic Anonymous, where it's like a circle time and everyone kind of talks about their experience that they had with addiction. So it makes you feel more normal. It doesn't make you feel like you're someone who's abnormal and you're the only one who is addicted. So you have to accept that addiction is an illness. Okay, it's an illness that people can go back to. So you have to kind of help that person throughout their life to maintain that amount of sober level, and also be clean and stay clean, right? So that's about addiction. Yes.
Is there any relationship between addictions and mental health disorders?
Yes, there is.
So can you just tell us more about it?
Yes, roughly about 50% of people who have some sort of, say, substance abuse may experience an episode of mental illness once in their life, and vice versa could be true. It could be true about the people who have a lot of mental illness, and they could also slip into the habit of substance addiction. Okay, now I would suggest that people become more aware about mental health disorders, and they get some psycho education about these illnesses, like for example depression. Now the most important thing is, a lot of people they go in to self medication. Okay, so for example, if a person is feeling really depressed, he may help himself by drinking alcohol and may think that that would help him to come out of depression, but that is not the case. Alcohol is a depressant, it is not a stimulant. So in fact, it makes you go more and more into depression. Same is the case with anxiety. If people are always feeling on the edge, they're jumpy, they're irritable, alcohol is not going to help you. Neither is any of the drugs going to help you. Okay, when it comes to more psychotic illnesses, something like schizophrenia, or an episode of hallucination, or say delusions, experiences which are more tactile and visual and auditory, where people really imagine the things that are not part of the reality and they're not in touch with reality, I would say all of these dependencies, like alcohol dependence, substance abuse, they really I would say trigger, and they make their experiences worse, they make their condition worse. So it's very important that these patients seek medical psychiatric help instead of self-medicating with different drugs and alcohol.
Shweta, I would also like to know more about the chronic mental health related issues and depression. Is there any relationship between these two things? Because depression is also a type of mental health disorder, but people with different mental health disorder also experience depression along with the actual disorder. So, what is the relationship between these two things?
I would say that depression could be having a comorbid presence with a lot of chronic illnesses, which are such as anxiety. Now, I would always say that anxiety and depressions are very close to each other, right? Someone who is experiencing a bipolar disorder, so here depression is already a part of it, where the person may really feel high on life, have the feeling of grandiosity, feels that they can conquer the world, but then again depression is a part of that. A lot of times what happens is that depression comes out of constant failure to adhere to treatment, right? So someone who has a chronic mental illness, for example, say that they have issues like a borderline personality, right? And they cannot really get on track with life. What happens is that these constant failures could also make them quite depressed, and they have loss of interest, loss of energy, loss of appetite, where they're not really in the world, in with life, and that they don't share that energy with their social circle. I also feel that people who go through a lot of trauma in their life. So for example, someone who has experienced sexual abuse, their childhood traumas, exactly. So probably that could come along, and depression would definitely add to their trouble. So experts have to kind of tease out and really rule out what the condition is, because if it's like a comorbid condition, experts are going to have to look into it more deeply and diagnose it quite perfectly, because the chances are that they might just say that okay, this is just pure depression, but it might not be. There could be a chronic mental illness which is underlying, right, like anxiety or anything else. So I would suggest that we need to have a very strong diagnosis.
Also, experiencing mental illnesses. I mean, many times they are ignored and they kind of need support. In my practice, I've seen that they need more support in terms of emotions, because they are clueless about what is happening with their loved ones, and they also sometimes experience severe mood changes. So, what is your experience in this? I mean, this area.
Yes, this is a very good question. And whatever literature that has been published till now, a lot of things have been spoken from the perspective of the patient who is undergoing a lot of treatment and who is undergoing a chronic mental health disease. But what about the caregivers? Yeah, the ones who are constantly around the person who is experiencing such condition, and because the patient becomes highly unpredictable at times. If he's off the psychiatric medication, he becomes highly unpredictable, and in that case the family also has to be supported with a support group,
right? Because they are always on age whether this person will react in a certain way or it will go out of their hand,
right?
So they are always on that age, and they don't know what to do.
Correct.
And that actually the what would you say,
The
trigger situation
Yeah.
is there. Many times they don't know what to do and how to deal with it.
Right.
So
a lot of psychoeducation helps, support groups. They being constantly in touch with the counseling team that is giving therapy to their family member helps. All the family members also need to kind of create their own lifestyle
and
support system within, and they need to always follow a very healthy lifestyle, because what happens is that because we prioritize our family member who is undergoing so much of mental concerns, what happens is that we do not prioritize our own life. And yeah, that becomes quite secondary, like our own social outings, or maintaining a healthy lifestyle, eating well on time, or doing exercise on a daily basis. These kinds of things, this kind of lifestyle helps these caregivers to build resilience to the kind of stress they are undergoing because of the family member who is already suffering because of the mental disorder. So I would also speak from another perspective. The team of psychiatrists and the psychologists who are helping this family have to also give a lot of support, and they also need to kind of be constantly in touch with the family, and they have to be open to their questions, which may sound little childish or ignorant, but we as a team, that is what we are here for, right? Constantly helping and kind of yeah.
So thank you so much, Shweta, for such an informative interview, and I would like to see you on the board for our services, and welcome on board. Thank you.
Thank you so much for having me here. Thank you.